Prostate cancer is a subject that many men prefer not to think about, especially when they feel perfectly healthy. Yet the story of Alexandra Muguaneza serves as a powerful reminder of why vigilance is so important. At the age of 69, Muguaneza was in good health, living his daily life with no complaints. But a single visit to a relative battling advanced prostate cancer changed his outlook forever. Witnessing the toll of the disease firsthand, Muguaneza realized that cancer could strike quietly, without warning, and that early detection could be the difference between life and death. Several months after that visit, Muguaneza found himself at the hospital for a completely unrelated reason. He was being treated for malaria. But the memory of his wife's cousin lingered. Even though Muguaneza had no symptoms, he decided to ask for a prostate-specific antigen, or PSA test. This simple blood test measures the level of PSA, a protein produced by the prostate gland, which can be an early indicator of prostate cancer. To his shock, his PSA levels came back at 105 nanograms per milliliter, a figure dramatically higher than the normal range of 0 to 4. This unexpected result led to a referral to a urologist, who ordered further tests, including a biopsy. The diagnosis was devastating: stage 4 prostate cancer. At this advanced stage, the cancer had already spread beyond the prostate gland into Muguaneza's lymph nodes. All 12 of his tissue samples tested positive for cancer. Yet, there was a glimmer of hope. The disease had not spread to distant organs, making treatment still possible. Muguaneza began treatment at the Rwanda Cancer Center, where he was placed on hormonal therapy to slow the cancer's growth, followed by a rigorous 37-day course of radiation. The experience was demanding, but Muguaneza persevered, supported by compassionate medical staff who guided him through every step. After completing radiation, he continued receiving hormonal therapy every 3 months to keep the cancer in check. He was grateful for the quality of care available in Rwanda, which spared him the need to seek treatment abroad. In 2023, Muguaneza's PSA levels began to rise again. Concerned, his doctors ordered a positron emission tomography, or PET scan, a sophisticated imaging test that detects cancer activity in the body. He traveled to India for the scan, and the results brought immense relief. There were no signs of cancer. Today, Muguaneza is cancer-free, though he continues hormonal therapy as a preventive measure and remains diligent about regular checkups. Looking back, he credits his decision to request a PSA test, despite feeling fine, as the choice that saved his life. Muguaneza's story carries a clear message for men, particularly those over the age of 45. Even if you feel healthy, do not wait for symptoms to appear before seeking screening. Early detection and timely treatment can make all the difference. Prostate cancer is not a rare disease. In Rwanda alone, it was the third most common cancer in 2023, with 516 cases reported, following breast and cervical cancer. While the disease primarily affects men over 50, recent findings show that men as young as 45 are also at risk. Troublingly, many cases are diagnosed at an advanced stage, when treatment is more complicated and the chances of a full recovery are lower. Dr. Theoneste Maniragaba, director of the cancer program at Rwanda Biomedical Center, points out that the reasons behind prostate cancer in younger men are not fully understood. While age is a significant risk factor, genetics may also play a role. Some studies suggest that certain genetic mutations, particularly among Black men, could contribute to early-onset prostate cancer. Yet, despite the growing number of cases, awareness about the importance of early screening remains low. Many men, regardless of their level of education, do not seek medical attention unless they experience symptoms, a cultural attitude that needs to change. Screening for prostate cancer begins with a simple PSA blood test. If PSA levels are elevated, doctors may recommend further tests such as magnetic resonance imaging, MRI, digital rectal examinations, or ultrasounds to confirm the diagnosis. Dr. Maniragaba recommends that men between 45 and 50 begin routine screenings, as prostate cancer often develops slowly and can go undetected for years. By the time symptoms appear, the disease may already be advanced, making early screening critical for prevention and effective treatment. When detected early, prostate cancer is usually small and localized, making it possible for skilled surgeons to remove the prostate gland entirely and achieve a full recovery. Many patients who sought care in time have gone on to live healthy, cancer-free lives. For men in Rwanda, screening and treatment are available at leading medical facilities such as King Faisal Hospital, Kigali, University Teaching Hospital of Kigali, Rwanda Military Referral and Teaching Hospital, and Butaro Cancer Center. These centers provide the necessary expertise and technology for early detection and effective management of prostate cancer. But what are the symptoms of prostate cancer? According to the Mayo Clinic, most prostate cancers are found at an early stage, when the disease is still confined to the prostate gland. At this stage, symptoms are often absent. The prostate is a small gland below the bladder that plays a role in the male reproductive system, helping to produce semen. When symptoms do occur, they may include blood in the urine or semen, increased frequency of urination, difficulty starting to urinate, or waking up at night to urinate more often. If prostate cancer spreads beyond the gland, it is considered advanced or stage 4. Symptoms of advanced prostate cancer can include accidental leaking of urine, back or bone pain, erectile dysfunction, extreme fatigue, unexplained weight loss, or weakness in the arms or legs. The message is clear. Prostate cancer can be silent for years, growing unnoticed until it reaches an advanced stage. That's why regular screening is so important. Men over 45, and especially those with a family history of prostate cancer or other risk factors, should make screening a routine part of their health care. Early detection saves lives, not only by catching cancer before it spreads, but also by allowing for more effective and less invasive treatments. Ultimately, the story of Alexandra Mugwaneza is a testament to the power of awareness and proactive health care. By taking charge of his health, asking for a simple test, and following through with treatment, he gave himself the best possible chance for a positive outcome. His advice to other men is simple but profound. Even if you feel fine, get screened. Your life could depend on it.